In this video, we will reveal 7 daily habits that can damage your kidneys and how to stop them before it's too late. So without further ado, let's get started. Number 1. Taking too many painkillers. A lot of people use over-the-counter painkillers like NSAIDs and analgesics to ease their pain. But these drugs can severely harm your kidneys, especially if you have kidney disease or take them a lot or in high doses. The National Kidney Foundation says that NSAIDs can lower the blood flow to the kidneys and cause inflammation and scarring in the kidney tissue. Analgesic like acetaminophen and aspirin can also damage your kidneys if you take them too often or in large amounts. So what can you do to protect your kidneys from painkillers? The best thing is to use them as little as possible and never go over the recommended dose. If you have chronic pain, talk to your doctor about other ways to deal with it like physical therapy, acupuncture, or meditation. Number 2. Eating too much salt. Salt is very important for your body. It helps to maintain fluid balance and nerve and muscle function. But too much of it can be very bad for your kidneys. That is because salt has sodium, which can raise your blood pressure and make your kidneys work harder to get rid of the extra fluid and sodium from your body. High blood pressure can damage the tiny blood vessels in your kidneys and reduce their ability to filter your blood. In fact, it is one of the main causes of kidney damage and kidney failure. So how much salt is too much? The American Heart Association says you should limit your sodium intake to no more than 2,300 milligrams per day, which is about 1 teaspoon of salt, but most people eat way more than that, mostly from processed foods that are high in sodium like canned soups, frozen meals, snacks, sauces, and condiments. To cut down on salt, try to eat more fresh fruits and veggies. Cook your own food from scratch using herbs and spices instead of salt, and read nutrition labels carefully when buying packaged foods. Number 3. Ignoring urination urges. Do you ever hold your pee when you are busy or don't have a bathroom nearby? If you do, you may be putting your kidneys at risk. When you ignore your urination urges, you are letting urine stay longer in your bladder, which can make bacteria grow and lead to urinary tract infections. UTI can be painful and annoying, and if you don't treat them, they can spread to your kidneys and cause serious damage. So what can you do to prevent UTI and protect your kidneys? The best thing is to listen to your body and go to the bathroom when you need to. Don't hold your pee for more than 4 hours, and try to empty your bladder completely every time you pee. Number 4. Not getting enough sleep. Sleep is essential for your health and well-being, but did you know that sleep also affects your kidney health? Your kidneys follow a circadian rhythm or a natural 24-hour cycle that regulates their function and activity. When you sleep, your kidneys reduce their workload and rest. When you wake up, your kidneys resume their normal function and filter more blood. This cycle helps your kidneys maintain their efficiency and balance. But when you don't get enough sleep, your circadian rhythm is disrupted, and your kidneys can't perform their job properly. According to a study published in the Journal of the American Society of Nephrology, people who slept less than 5 hours per night had a 65% higher risk of developing kidney disease than those who slept 7 to 8 hours per night. Another study found that people who slept more than 9 hours per night also had a higher risk of kidney disease, suggesting that both too little and too much sleep can be harmful. The recommended amount of sleep for adults is 7 to 9 hours per night. To improve your sleep quality and quantity, try to follow a regular sleep schedule. Avoid caffeine, alcohol, nicotine, and heavy meals before bed. Limit screen time and exposure to bright light at night. Create a comfortable and dark sleeping environment and practice relaxation techniques such as meditation, yoga, or breathing exercises. Number 5. Not drinking enough water. Water is essential for life and for your kidneys. Water helps your kidneys flush out toxins and waste products from your body. Without enough water, these waste products can build up and cause problems like kidney stones and chronic kidney disease. In fact, drinking plenty of water is one of the best ways to avoid kidney problems and keep them working well. So how much water do you need? The amount of water you need depends on many factors such as your age, weight, activity level, climate, and health conditions. A general rule of thumb is to drink at least 1.5 to 2 liters of water per day. However, you may need more or less depending on your individual needs. To stay hydrated, drink water throughout the day, especially before, during, and after exercise or when you feel thirsty. You can also drink other fluids such as herbal teas, juices, or soups, but avoid drinks that have caffeine, alcohol, or sugar, as they can dehydrate you and harm your kidneys. Number 6. Smoking. Smoking is one of the worst habits you can have for your health in general, but especially for your kidneys. Smoking damages your blood vessels, which reduces the blood flow to your kidneys. This can impair their ability to function properly and filter out waste and toxins. Smoking also increases your risk of developing kidney cancer, one of the most common types of cancer. According to a study published in the Journal of the American Society of Nephrologists, smokers had a 60% higher risk of developing kidney failure than non-smokers, so the most important thing here is to stop smoking as soon as possible. Remember that quitting smoking is not only good for your kidneys but also for your lungs, heart, brain, skin, teeth, and overall well-being. Number 7. Drinking too much alcohol. Alcohol is a diuretic, which means it makes you urinate more often. This can dehydrate you and make your kidneys work harder to maintain the fluid balance in your body. Alcohol also affects the liver, which produces a substance called urea that is filtered by the kidneys. When you drink too much alcohol, your liver produces more UA than your kidneys can handle, which can cause kidney damage. So what can you do to limit your alcohol intake? The recommended limit for alcohol consumption is no more than 1 drink per day for women and 2 drinks per day for men. If you drink alcohol, drink it slowly and with food, and ultimate with water or other non-alcoholic beverages. Avoid drinking on an empty stomach or when you are thirsty or tired. Like, subscribe, and hit the bell icon.